All right, ladies, I look forward to having this discussion with you. I actually had to kind of blur my background, and there's a mess behind me because we move out of our house today. And I had to adjust the stand of my microphone. So all these little changes are kind of rattling me a bit. But I appreciate you guys. I know it's the very end of summer and we're tying this together before we get back into school routine and September and all of that. But I was thinking before we got onto this conversation of, this is the first episode of a new kind of chunk of episodes coming out for the fall. And I liked the idea of starting with this topic because a lot of listeners are other pelvic health physiotherapists. And before I put out an email saying, what does everybody want to hear about? And I got quite a few requests for newer pelvic health physios and suggestions for courses that they should take. And before I ask you both to introduce yourselves and kind of why you're kind of on this episode, I want to take the time to kind of thank you guys for what you do, because we're seeing such an increase in kind of awareness of our profession. And I think that a lot of new physios assume that some of the, let's say, senior physios are not welcoming, or that, oh, I'm getting into this profession or this area of our profession, and I feel intimidated by what some of the other people think about my practice. And I was so thankful when I moved to Kelowna and was introduced to Corrine Wade. I was really intimidated to meet her because I thought, oh, what if she is upset that I'm taking some of her clients, or, I hope I don't step on her toes. But I feel so lucky to be in a community where we all support one another and work together. And what you're doing is so helpful, not only for clients, but our profession, and then also so many other physios that are really interested in this area of practice. So first, I just want to thank you for all of the work you do. And then I'm going to ask you guys, I know you both professionally first, and then obviously personally. And I thought of asking you to join because you've started up kind of like a mentorship offering, not just another course that teaches people theory and ideas around practice and treatment, but let us help you go from what you're learning in these courses to actually putting it into practice and feeling competent and confident in that. So just to set the stage, this is why I wanted you to come on, because I really appreciate what you're doing and thought we could talk a little bit about the differences between taking courses and doing something like a mentorship, which is what you're offering. So after all my yak, I'm going to get you both to introduce yourselves, Anniken and Trish.
Okay, so yeah, hi Mel. It's great to be back. My name's Anniken Chadwick. I have a clinic, a pelvic floor specific clinic in East Vancouver, and I've been a pelvic floor physio for years. And in the last couple of years, we launched an external training and mentorship academy, which is what you were referencing. So yeah, I would say that where sort of my perspective on this is that I was a pelvic floor physio working on my own in ortho clinics, trying to find my own way, trying to figure it out, taking courses and not really having community or support around me, or having to find it online. And I didn't know what I didn't know. I didn't know what I was getting wrong. I got a lot wrong. Yeah, it was a lonely road, and it was hard to find my some confident feet, and really there was no roadmap. So part of my sort of mission with the clinic and with the academy is to help provide the physical space in the clinic and an online space with the academy to help physios with that roadmap, so they can position themselves and they're like, okay, this is what I know and this is what I don't know, and this is where I can get support, and this is where I can figure out where I'm at with specific clients. Because there can be so much unknown when you're starting in a new niche. So yeah, I'd say that's my intro.
And then you were lucky to latch on to Trish. You found Trish.
Yeah.
Yeah, so my name's Trish Gipson. I am the Director of Clinical Services at the Cheerful Pelvis, and I'm involved in Cheerful Academy in some curriculum development and teaching the Pelvic Health Fundamentals course. I have been a pelvic health physio since about 2010. And before that, I worked as an ortho physio for years, did all the manual therapy stuff, the FCAMP stuff. And then when I started in pelvic health, I was like, oh, there's no way I'm going to do 100% pelvic health. I want to do a mix of ortho and a little bit of pelvic health. And then pretty quickly, I was like, okay, there's a lot of ortho physios that can treat these clients, but there's not many pelvic health physios. So then my caseload in pelvic health grew and grew. And pretty soon it was just 100% pelvic health. But much like Anniken, I was like, just figuring it out as I went along. I was doing pelvic health in an exclusively ortho clinic. And yeah, just figuring it out as I went along, making lots of mistakes, reaching out to people, trying to get some mentorship, but it was really hard. I think at the time that I started, I could probably count on one hand the number of people in the Lower Mainland practicing pelvic health. So it was really, really hard to get this support. The support was awesome, but it was just, there weren't many people able to provide that support. And then fast forward to a few years ago when I joined Cheerful Pelvis, and then ideas just flowed, and then came the Cheerful Academy, and here we are.
Well, I think that because I started, working in pelvic health after working in public health. And I switched from public health to private practice niche area. And wow, that was scary. And same thing, like just figuring it out as I went. And I can't believe how many times I'd always get permission from the client, but I would say, do you mind if I take a picture of your vulva? I need to send it to someone because I need to ask them. Like, I'll be honest with you and tell you I don't know what this is or what have you. And I think that it's hard to bring someone else into the room sometimes, like it's different than a knee. It's hard to bring someone else into the room to talk about things, but I think that's a very common thing with some of us that started a bit earlier, is I just tried to figure it out. And I think we're so lucky that we work in an area that has a lot of evidence to support it and a lot of momentum. So we're seeing this surge of physios that are interested, or maybe they're also working in clinics where they're encouraging more pelvic health training, but they're hearing more about it, the practitioners, and knowing that there's more courses or more information, but fumbling a little bit with where do I need to go and what courses do I need to take. So will you guys talk a little bit about, because I know you have a pelvic health centered clinic, so you see a lot of this. Can you talk a little bit about this increasing popularity of pelvic health practitioners or more patients seeking out these types of practice? What are some of the trends that you see? Because obviously you have a clinic for a reason. Do you know what I mean? You have a growing clinic for a reason.
Yeah, well, I think there's a general upswell of pelvic health literacy. People, it's trending, clients, parents, pregnant folk, they're learning more and more about it. I think there's more referrals. I think as the evidence has grown and as word of mouth has grown, people are just taking care of themselves more. Women, pre and postnatal folk, they're taking care of themselves more. They're learning that a lot of, it's very common message in public health. It's common, but not normal. Like that's less relevant message now. People know that things aren't normal anymore. So I think there's an upswell of interest for great reasons from the public. And then I think for professionals, I think there's also a shift moving through generations where we want to work in areas that fit as our personality or fit our interests, like gone are the days where everyone becomes a generalist. Physio, like people know who they are. There's more options for them. There's more options as the profession has grown and developed in areas of niche practice. There's more options for them. So I think it's wonderful that we can graduate and we can be like, well, I'm this type of person and I'm really interested in this type of thing. And I really believe that if we work in an area that really inspires us, we're going to be happier at work and we're going to do better at work. So that's what I've seen.
It's such a shift from when we were in, sorry, Mel, I was just going to say, it's such a shift from when we were in school. Like I remember, there was only a little bit of talk about the pelvis. And I remember in my head being like, oh, well, that's an area of practice I'll never work in, because there was so much stigma. There's so much taboo. And, I'm not that old. It wasn't that long ago. But that's evolved. And now it's like there's more education around the pelvis and pelvic health issues. And people are getting excited about it. They're seeing how it can, significantly improve people's quality of life. And that's why we do what we do, right? We can see improvements in our clients' quality of life. And that's inspiring. And that's what people want to do. And so I think that's helping draw people to this sort of niche of pelvic health as well.
So, and are you guys finding that, let's say, because obviously your clinic space started before the academy. So were you noticing that a lot of people that, let's say, applied for jobs were new out of school, or that were they coming kind of as generalists first? I'm curious to know. I think I'm wanting to make sure listeners can kind of identify with other people, like, oh yeah, that's me. Or, so I'm looking to know who what I'm eventually getting at is, why did you start the academy? But I'm kind of looking to see first, like, what trends were you seeing with people applying to work for you?
Yeah, definitely. And I mean, we're a clinic that is very much obviously built on teamwork and mentorship. So we're going to catch this type of applicant too. But yeah, a lot of people who are either new grads or in their first 1 or 2 years of practice is predominantly who wanted to come and work with us. And yeah, I think specifically because they all said the same thing. I want to get into pelvic health, but I know I need support. I need the mentorship. And so yeah, that was, and because they knew that we offered that was obviously appealing for them. But yeah, most of the people that we've hired over the last few years have been really early in their practice. And we've had a lot of conversations about that, Trish, as to, and we've talked about that too, Mal, as to what like the pros and cons of that, essentially.
Yeah, when I first jumped on and joined TCP, I was like, no, we got to get experienced physios who are transitioning to pelvic health. I really had strong feelings around that, where I was like, no, I really think that people need to sort of learn to work with humans, first of all, and just have a general sense of how the body works. And I've evolved my thinking over the last few years, because I really have seen that with the right amount and the right type of support, it doesn't matter where you start your journey. Like in the end, you're going to be treating an individual. So maybe you start, focusing on the pelvis, but then you zoom out and you're thinking really holistically, versus someone who's thinking holistically to start and then starts focusing a little bit more on the pelvis. It's just a different path.
Well, and what makes us all unique, right? Like, yeah. What, because I think all the time, my background is acute care and neuro. So I feel very comfortable with seeing people fresh after surgeries or fresh after birth, or, thinking about the nervous system. But please don't talk to me about your shoulder, because I'm probably going to get really nervous because I don't remember. I haven't done that since I was in school. And so, but whereas someone else that has started, maybe they don't have that acute care knowledge. They're not quite as, versed in, let's say, thinking about the brain or the nervous system or acute care, but they can think about some of those other concerns when you come in for your shoulder. Do you know what I mean? It's just what makes us all unique. I'm curious to know, this is just curiosity, but do you find that you get a lot of people reaching out because their workplace is requesting they do pelvic health? Maybe they don't necessarily feel passionate about it, but they're feeling pressure?
Not the physios, but I get clinic owners reaching out saying, okay, my physio's taken one internal course and we're starting this service and we don't know what we're doing. Gotcha. And how do we do this? And how do we make sure that the care is good enough? And I was like, oh, there's a lot in there. right? I mean, I think I agree with you that there's definitely, it's trending, it's definitely, and I think there is absolutely a place for pelvic health physio in ortho clinics. I don't think everybody should be in a niche clinic. I think we need both. And so I think there's a place for that, but I definitely think that there's a lot that we don't know about how to set up a really good quality pelvic health service in ortho clinics. And it's trial and error, which is exactly what it was like for me in my clinic. It's trial and error and we learn. But that's one of our goals with the Academy, is to offer a means of support for clinic owners. So we're like, okay, you've put your staff through internals and then they don't really know what they're doing because they're the only person in the clinic doing it. And we're hope to fill that gap to help support the clinician, but also for the clinic owner who's like, I don't know if they're okay, or, you know, what the quality is like, or like they can't mentor or check that it's a good service, which I think is important to clinic owners. So it's not that we would ever sort of like monitor the people that we teach, but we can certainly help and support them in the way that we've learned works in our clinic. So we've tested it within ourselves. Yeah.
So then can you speak a little bit for people that maybe either clinic owners or practitioners that are contemplating pelvic health or starting, can you speak to some of those different nuances? Why is it different practice? Why is working kind of with the orthopedic client different than the pelvic health client? Because they're still an individual, as Trish mentioned. But like, so can you just speak to some of those differences and why does this even matter?
I think a lot of times the question that we're getting is like, what course do I need to take to start working in pelvic health?
Mm-hmm.
And it's so not that simple. It's like you can take, you know, a lot of the courses are set up like level 1, 2, 3. And there's some misconception that you can like just take that first level 1 course and start treating, which, you know, in terms of, you know, requirements by the college or whatever, yes, technically you can, but your preparation for what you could potentially have come through your door is so minimal. Even if you take all the entry level courses like level 1, 2, 3, or however the setup is, it's still like, okay, now I have a map of the pelvis when I do an internal exam. Now I know the list of questions to ask. Now I know the list of, you know, pathologies that I might see, but the connections aren't there. So you don't have the clinical reasoning skills. You don't have the interpersonal skills that I think are very unique to this demographic. I think in pelvic health, there's probably other parts of physio where you like, I'm thinking persistent pain, where you need to be really, really trauma informed, very empathetic, really have a unique skill set for how to relate to people. That's definitely needed in pelvic health. And that certainly isn't taught in the intro courses. And so I think those are the big things that are really important to realize when you are setting up, you know, a pelvic health practice, or whether you be a clinic owner or like an ortho physio trying to branch into pelvic
And
health.
would you say then, Trish, that one of those biggest differences between, like, again, like I know it's a different type of client and a different kind of level of conversation, but our physio training is geared towards the orthopedic practice in a lot of ways. Like we practice practical components. Exams are not geared towards that. So we're not really kind of going through those motions. You know, I think, because again, my training was a while ago, so I know a lot has changed, but we didn't practice on that type of client. Yeah, at
Even
all.
something as like something that's been ingrained into us from, you know, beginning of physio school, like informed consent. When you're dealing with pelvic health, with a pelvic health population, even the way you get informed consent is so different from what's taught in physio school. And I think they could probably teach a course just on how to appropriately get consent in a pelvic health setting, I think. I think, yeah.
And one of the things that I was noticing, go ahead, Anniken, what were you going to say?
I was going to say, I think the other thing is that it's taught, like pelvic health is taught like its own separate siloed thing, as opposed to something that's within generalized musculoskeletal orthopedic physio, which is actually what it is. So it's taught as a separate entity, and whereas it's not. So a lot of the work we're doing is try and like unsilo the thinking to bring it in with everything that you already learned. But because it's considered a separate thing, I think that's where people get stuck. It's this separate thing. Now I'm in pelvic health. It's this whole new area of physio. I don't know how to apply the things I've been taught and how to filter it through the pelvic floor lens, as Trish was saying. And when we're in practice, everything's behind closed doors. Like you can't watch your colleague or your boss out of the corner of your eye and like learn in the gym, right? You can't, everything's behind closed doors. So there's just so little exposure. Because I learned so much with MSK in that way by like listening to my colleagues through the curtains and things, right? And this is like, we don't know what happens behind the doors, and it's a little bit harder to shadow and co-treat. There's just this extra layer of kind of the barrier that you have to get through to get exposure to styles of care that we can learn from each other. So I think that's another reason it's different.
Yeah.
And that just Sorry, I was just going to say that just leads to like more and more confirmation bias. When you're behind a closed door and it's just you and your client, you're doing what you're doing and you're like, huh, that worked. Great. And then you just keep going down that, oh, that worked for me path without seeing any other options. And I think it really does narrow your practice versus if you're working with peers or learning from peers, that's really going to broaden your thinking and broaden your practice.
Absolutely. One of the things I noticed in my community of Kelowna is for the longest time, there was only a couple of us that were doing exclusive pelvic health. And obviously, like, spent a lot of years building up caseloads, which meant we got very busy, hard time seeing clients, right? Luckily, there's a lot of physios that are new to pelvic health, interested in it. But I do know it's harder for them to get referrals just because in a smaller community, I think people get used to referring to the same person over and over again. And it just, isn't known yet for, let's say, a pelvic health clinic. And so, but I would hear from a lot of clients, oh, I've already seen someone before. Oh, I never want to say, who did you see? But can you tell me a little bit about what makes you change? Well, I just felt like that person didn't have much experience, or I could tell that they were new in their practice, which I always think, oh my gosh, I've been there before. Oh, how many people left me because I did something, So it kind of made me think, oh, I'm so glad to hear there's new practitioners in town. What can I do to give back? Because I felt like I had so much support too. And so saying yes to some things, like I will do the lab occasionally for pelvic health solutions, or I tried to set up some just one-off, just reached out to some of the physios in the community to say, do you want to just get together and do a group mentorship? I'm happy to do that. And like I'm just trying to mirror some of the things that you said, that really what their questions were, okay, how do you set up the room? Do you use paper sheets or cloth sheets? How long are your appointments? Where do you stand when, where do you leave and where do you start charting while they're changing? Things like that. And I thought, oh, I'm so glad I did this, because their questions are actually really different than what I thought. And they're hung up on those questions before we even talk about the stuff in their lab manual. And so again, another reason I wanted to reach out to you guys, to talk this through, because I think this is such an important thing for newer pelvic health physios to consider, because I think just sitting down, and I'm going to get you to describe your academy here right away, but so lay it out for people. But I know that there's a lot of cohort based learning, so that, some people are less of a sharer and more of a listener, and they learn so much from listening to others. And like you said, Trish, less kind of confirmation bias from just reading a manual and doing some of the same things over and over, but listening to someone else. Oh my gosh, I didn't even think about that. So I am really interested, because again, you live in Vancouver, I'm in Kelowna, but I think it's great to know that your academy it's not in person. So people can access this outside of the Lower Mainland. So that leads me kind of to what I wanted to ask you guys about. Can you describe you've seen some of these, let's say, holes in care, gaps in knowledge, people having a hard time translating what they've learned into practice. Tell me what made you create the CAT Academy and describe what that experience looks like.
Well, well, it was a journey. So we have been our awesome staff at the clinic are our guinea pigs, and the current model of the academy has gone through so many iterations, you know, because I know what we always wanted to do was make sure that people were learning in their own way, learning at their own pace, and that they had and that it was the reasoning that we were actually, so it wasn't, we didn't want to give like an information dump where you're overwhelmed and then you're like, okay, I don't know how to apply this. Like, we saw that the problem was the application. They have the knowledge, they don't know what to do when the client's in front of them, or they've tried the one thing that they were taught and it didn't work and now they're stuck. So we know we wanted to tackle reasoning. And so we found a balance. Like, we started off with just ask us questions, and it was just very much driven by the mentees. And then we realized that there was really not enough structure. They need the support of structure in order to like frame their questions. We realized that coming out of most of the courses that the people we hire take, they have the knowledge, but they don't have enough of a reasoning framework to really base the questions that they needed to ask us. They're just like, I don't know enough yet to frame questions. And so then we started developing frameworks where we're like, okay, how can we give a framework for thinking that is a tool that people can actually use right away in the treatment room, so they can position themselves. So let's say somebody has stress urinary incontinence. We develop a framework that tells them all the things that could be contributing towards that. So then they can look at the patient in front of them and they have a map that they can use. And then we can tackle the reasoning around all those individual things and then piece it together as the whole picture for the patient. So that's where we've ended up now, where we give people frameworks. So we do this sort of the structured reasoning work for them, and then they can use those frameworks with the client in front of them to figure out what's going on and sort of to say yes or no, and they can come back to it. And then what we do in the course is we build it over the 8 weeks. So we sort of we've selected the main, we call it the fundamentals. It's like the majority of stuff you're going to see. It's not complex pain and trauma or complex orthopedic stuff, but it's everything else. And so we build over the weeks conditions on top of each other, because obviously you have a client that comes in that might have stress incontinence and something else, and prolapse and something else. And so we build it up, and with the goal that by the end of the course, they're used to seeing these complex presentations and they can figure out how it all fits together. So when it comes in the room, it's not a surprise and they're like, oh my God, there's so much stuff, I don't know where to start. We're trying to, and it's open, because very much like Trish and I are very different physios. And just as you've talked about, Mel, like there's no one right way to be a great physio. So we give this open framework and then support people to practice in the way that's best for them, with them, as long as they can figure out what's going on, right? Then they can work in their own way. And that's really exciting for us. And it's really exciting in the cohorts to see that diversity of approach too.
Trish, will you lay out then? So if someone was like, oh, what does this look like? So this is an 8-week commitment?
Yeah, it's an 8-week. We meet once a week on Zoom. We've got recordings, but because we do so much facilitation and sort of group discussion, I think you really get the most benefit from attending live. And then we also have office hours too that people can pop into and ask more questions. But we start off a little bit more directed by us. And then over the 8 weeks, as the participants' reasoning and learning increases, they start piecing the connections together themselves better and better. Then we get a little bit more hands-off with the reasoning and just kind of give them that framework to work off of, give them a case study, and then let them do the reasoning work. And then it's really, really cool to see those connections being made over the 8 weeks. And so we start off talking about more interpersonal skills, and then we start talking about like pre-postnatal stress incontinence, urge incontinence, overactive bladder, vulvovaginal pain. What am I missing?
Prolapse.
Bowel basic stuff. Yeah.
And prolapse.
And
Yeah.
prolapse. Thank you.
I'm curious to know then, actually, I want you to share what some of the feedback has been from people listening, or for people listening. What are some of the other participants? What have they said about it? I'm putting you on the spot and I don't know if you have that in front of you.
Well, my favorite feedback, which is what comes to mind, was the people that shared exactly what we wanted, that they feel more confident, that they could use the stuff right away in clinic, and that it just sort of like brought them out of the confusion that they were in, so that they'd done the courses, they knew they had the knowledge, they just were a bit insecure and stuck and just didn't feel that they had a sure footing. And yeah, because that's what we say. We're like, we want to give you clinical competence and confidence. And when we heard that back, I was like, yeah, great. We got it right. I was so stoked to hear that. And another interesting thing is that because it's reasoning, people who do generalized ortho too shared that it helped them with the ortho reasoning too, because it just was giving a framework for thinking that can be applied in any area of physio. So that was interesting, something I hadn't expected.
Yeah, it was really cool to hear how much those frameworks helped, because we developed them because it was like, hey, this is kind of how our brains work when we're reasoning through. Let's see if this is helpful for other people. And it was really like hearing the light bulb moments when people were able to use those frameworks. It was really validating. It was really, really nice. And it was like, yeah, okay, we're on the right track. This is great. So that was fun.
Well, and I think too, like if I picture myself, if I was a participant, I feel like one of the things that I would get out of it is just, okay, I'm not in left field, or, someone else has that same imposter syndrome, or like just always like this kind of perspective. And I think too, I would feel less nervous about you guys. Like I would feel less intimidated by you because I've worked with you. And then if I ever wanted to apply to your clinic, I would feel like I know these people, I know what they stand for, or they know me, or I feel more comfortable reaching out and asking them something now, or I've made these connections with these other participants and maybe I just text them, or, I can just picture that I always feel better getting together with other practitioners and just being able to kind of like, are you feeling stressed about this too? Or do you feel like you don't know about this? Or do you feel this is happening in our community? I always feel better after I talk with other people that are in that same closed four walls as I am, right?
Yeah, that community piece is so important. Certainly we feel that in the clinic, within the walls of the clinic. And so we are doing our best to create that for people in the academy, especially, Melissa, I know you mentioned people in smaller communities who are newer to pelvic health, physios who are not getting the referrals. There's also physios who are new to pelvic health, where they're the only pelvic health physio and they're getting all of the referrals, yes, even all the complex referrals, and they do not have the experience for it yet. And there's there's nothing wrong with that. I think that's really what the goal of the academy is. It's like, there's nothing wrong with physios moving into pelvic health and really not being confident and knowing what they're doing at the beginning. That is the roadmap in our profession right now. Like, it's not regulated. That's what every pelvic health physio in Canada has done. So it's like this, we're trying to create that community of support for people. And just as you said, so they know that they're not the only one that is feeling stuck like that. So when we can sort of take that individualized insecurity and put it aside, that's when we can really start to think and learn. Because when you're feeling on your own like that, it's really hard to actually reason and figure stuff out. You just feel a bit swamped. So yeah, one of the goals that we're starting, actually, our next course is in January, and we're going to be at the request of some of the participants of our last cohort, starting more of an ongoing community offering. So people, if they want to, can stay in touch with us, can continue to use open office hours, and can be in community with their peers. And I think that will be especially important for the rural participants.
Will you describe, because I know people are going to be interested in looking into this. Will you describe the investment? What does it cost for people to go through the academy?
Yeah, the full price is $1,200 for the course and all the sort of materials, all the structured thinking that we give you and the office hours. And then that also gives you like a few months access to our community with the additional offerings we have in there too. And I know coming up, you're going to share that there's a discount for your listeners too
Yes,
with that.
absolutely. We'll put all that in the show notes, but yes, absolutely. We'll put all of those details in the show notes, but I think I think it was December 15th, we decided on Anniken that, but if they sign up before that time, they have $150 off. So,
Yeah. Yes.
is there a cap on how many people actually that you take?
Yeah, we did about 15 last time, and that worked really well. I do think we could go up to 20, 25. I would not go above that right now. That would be a trial, because it's really important to us that people have the opportunity to share their reasoning if they want to. There's great ways to do that on Zoom. We have great, our facilitation is good in allowing people to do that. I'm really proud of how we've set that up. But yeah, there is a cap because we want people to be able to participate. It's not a didactic course. It's
Yeah.
really one that you take part in as much as you're comfortable to.
I think that's an amazing, I think it's an amazing deal, to be honest, with the amount that a course costs, and then this being able to kind of tie in all the courses you have taken and make it practical. I think that's very fair. Any, were you going to say something, Anniken?
Well, I was just going to say that I feel like we've tried and tested this in the clinic. So in the clinic, we had people that did those internal, I often do pelvic health solutions, level 1, 2, and 3. And we've worked on this material and figured out, like, we're trying to fill the gaps for people. And we've found, and everybody has their own learning journey and pace and speed and interest. But what we found is really we can, with this course, get people to a really solid level of practice that will see them through, a good few years as they really just get their teeth into being a good pelvic health physio before maybe, and with my team, it probably takes a couple of years before they then want to go and sort of add and learn anything else. So that's in terms of sort of like mapping out, I have so much to learn, like what we've tried to do is fill the gap. So then when you take courses, you have a really solid base and you can do that endo course and you can apply it easily because you're really solid with your reasoning and you're confident with your clients. And you're not trying to fill a big gap that you have. You're just like adding knowledge then and integrating it well. So.
And I think such an important thing that I think is important to point out that maybe people don't think about is that I think so often when you're a new practitioner, you don't, well, it's natural to not know what type of practitioner you're going to be because you have to find your way. And I think there's such a benefit to having, both two different personalities and two different ways you have come at this profession, that just for them to be able to see these differences, because I think not that there's a downside to there only being one facilitator, but a downside would be that you're just hearing one perspective, right? Or one personality. Whereas I think there's so much benefit to hearing those kind of two sides of a coin, or if you will, or two different perspectives, and to help people be able to see that I can be my own practitioner and still be effective. And look at how these two women who are very different are coming together, but wow, they're different, right? And so I think that helps people see, like, I don't need to be like Trish. I don't need to be like Anniken. I'm going to figure this out myself. And it takes time. I'm curious to know, actually, in your last group, can you speak a little bit to, let's say, like, how were some people that took it, had they been working for quite a while in pelvic health? Who do you think is most suited? Is it, and I know it can be anyone that's looking to kind of feel a bit more confident and think about some of this stuff, but maybe speak a little bit to who's best suited?
It's really primarily directed for like the newer to pelvic health physios. That being said, we did have a couple experienced physios in our last cohort. Not actually newer to pelvic health, like they'd been practicing pelvic health for a bit. And the feedback from them on what they gained from the course was fantastic, which was really, really nice, that even if someone does have some experience in pelvic health, they are able to get a lot from the reasoning framework as well. But when we developed it, the intention was to develop it for newer to pelvic health physios. So those physios that have taken maybe the intro courses have all that basic knowledge and just need help piecing it together. Essentially, it's kind of like expediting their learning and experience. So, maybe it took us 7 years to get all the experience and learn from our mistakes and figure it all out. And we're hoping to expedite that for them, so that instead of it taking 7 years to get to a certain sort of level of knowledge and reasoning, they can get there in 3. I don't know. I made those numbers up, but you know what I mean.
Well, listen, I feel honored that I can use this platform to help you guys share a little bit about your mission, because there is this wave of pelvic health momentum right now. And I think that not only is that exciting for patients, like the number of patients or clients that come in and they're like, I'm fascinated with this. My friends are talking about this. My doctor's starting to talk about this. So not only for patients, but the fact that more practitioners are wanting to move into this area, or let's say referring between one another. And then that your mission is to make the quality better, or to improve our care, not only so that probably for longevity of practitioners, that they can feel proud and confident and more longevity in their practice, right? But also just that we are providing a good service. I think that is very important, because I think that's one risk. And again, please, I made all sorts of mistakes, but I would just say, like, sometimes I could have prevented some things if I would have just done something like this when I started. And so I think that there's a little bit of, I don't want to say danger to this wave, if we don't have good quality practitioners. And I know what you're saying. It's not like, oh, you have to take this mentorship or you're not a good practitioner. It's just, we all learn differently and we all benefit from different things. And if you are someone that feels something's missing, then there's options out there to make yourself feel more of a quality practitioner, right? And so I'm really honored that I was able to kind of share some of this work that you're doing, and I hope that it lands with people and that people hear about it. But before we wrap up, is there anything else we didn't talk about, you guys, that you think would be helpful to get out there, or that I didn't ask you about?
I'd love to just acknowledge the work that you're doing as well, Mel. You do so much work. And I know so many of the people that we've mentored and our staff at the clinic have gotten so much out of your podcast, which I know takes so much work. Mm-hmm. Yeah, I just want to thank you for that, and that to what you're doing to add, to fill the gap in learning for our profession too. You do such a good job.
Well, it's kind of neat to just see, like, we're all part of this wave and we're all just coming at it from a different angle. And that's kind of neat. And that's what I was thinking at the end. I was like, oh, I'm glad that I could use my platform to help them do their thing too. So that's great. And I think that's like one take home. I think, like, in your community, reach out to other people and be like part of something, not feeling like you have to be in your own little silo. It's so much more enjoyable if you're part of something, right? Yeah.
Agreed.
Well, thank you, ladies, both for your time. Again, I'm going to share all the details of how people can access your academy, the discount they can take advantage of until mid-December. And I hope they can get it before it fills up, because I'm sure that you're going to see some good numbers, and people would be really lucky to be into your academy.
Thanks for having us, Mel.